The first thing that we want to review is the female hormone system. Ovaries produce three main hormones: progesterone, estrogen, and testosterone. In the process of going towards menopause, women begin to reduce the amount of progesterone and testosterone they make long before they actually hit the menopausal date. Estrogen is the last hormone to decline or disappear. With the loss of estrogen comes what is termed menopause. Several years prior to this point, women will begin to experience certain symptoms. Sometimes it's hot flashes or sweats, sometimes it's weight gain, sometimes it's anxiety. But whatever the case, it is usually as a result of a decline in both the progesterone and the testosterone. Our purpose is to try to help restore these imbalances even before menopause occurs. For those of you that have not yet reached menopause, we will generally begin by replacing progesterone and testosterone. For those of you that have already hit menopause, we will simply add estrogen to that treatment plan. In the process of looking at these hormones and what they do and how they relate to the symptoms you're feeling, I'd like to describe the basic cycle that women normally go through with a normal menstrual cycle. Normally, through the course of the month, estrogen and progesterone stay in a very delicate balance. There's ebbs and flows, and so they're never at the same level through the given month. But as the woman nears her menstrual cycle, when the bleeding will begin, progesterone makes a drop, and this drop in progesterone is what causes the onset of the menstrual cycle. It's a trigger, if you will. A lot of ladies experience what is termed PMS, premenstrual syndrome, which is a constellation of symptoms that include everything from irritability, wide emotional swings, weight gain, bloating, appetite changes, all of which are not very pleasant. Some ladies experiencing them to a greater degree than others. Other ladies experience relatively few, or some will even say they have none of these. But whatever the case, all of these symptoms are as a result of the lack of balance between estrogen and progesterone. As progesterone drops in order to signal the period, estrogen is left by itself, you could say. A better term would be, rather than saying PMS, would be to simply say estrogen dominance. Estrogen is in full control of how a woman feels and experiences her life. Now, the reason I bring this up is to help you better understand what is occurring in a woman who is not yet at menopause, but whose progesterone has been steadily declining. If we look at those symptoms that we just described as PMS, most of you will sense or see that are low in progesterone a lot of those symptoms in your life, except they don't go away after the period starts. Normally, once the period begins, a few days into the cycle, progesterone and estrogen go back into balance. Shortly thereafter, the bleeding stops. For those of you that are experiencing the premenopausal symptoms, frequently the bleeding becomes very irregular because the progesterone never goes back up in the way that it is supposed to. The irritability never stops. The emotional never stops. The weight gain never stops. The bloating never stops because the progesterone and estrogen never come back into its full balance. So what we will do is we will attempt to restore that balance by adding progesterone into your treatment. Progesterone is very easily given. It's taken as a capsule at bedtime because if we take it any other time, a woman will feel extra sleepy or tired during the day. Progesterone in most ladies adds a sense of relaxation or in some cases sleepiness, and so therefore we only use it at bedtime. The prescription will simply say take it at bedtime and will have a range to take, beginning with one capsule the first night and then slowly increasing as directed on the prescription up to 3. When we reach 3, we ask you to hold at that dose because most ladies require somewhere between 3 or 300 milligrams and 4 capsules or 400 milligrams. The symptom of too much progesterone is simply a feeling of excessive drowsiness the next morning or a feeling of dizziness, a sense of over-medication. If that sensation or feeling occurs, we ask you to simply reduce the dose back by 1 the next night. So, going back to the other hormones again. Testosterone is the other hormone that is declining in this pre-menopausal phase. Now, it surprises some ladies that they even need testosterone or even have testosterone. Another surprise that most fail to understand is that in actuality, prior to even coming close to this premenopausal phase, let's say go back into your 20s when your hormones are in a reasonably good balance, most ladies produce more testosterone per day than they produce estrogen. Now, estrogen is still the dominant hormone, the primary hormone of effect, but yet they produce more testosterone. So testosterone is not some insignificant hormone. It is a major portion of what makes a woman feel her normal self. So as the testosterone drops, she begins to experience multiple symptoms, many of which are a little opposite of what we think of testosterone. For example, many times we think of testosterone as causing aggravation or rage or things of that nature, and it does at significantly elevated levels, but at normal levels it doesn't cause that. In particular, for ladies, a low testosterone will cause a sense of anxiety or even depression. Onset of panic attacks occur not because there's a deficiency in Prozac or some other antidepressant or anti-anxiety medicine, but because frequently there is a lack of testosterone. We replace testosterone through the skin. We cannot swallow testosterone. If we swallow testosterone, it is hard on the liver. So our options are a cream, which works relatively well in some individuals, or a pellet. A pellet is something that is placed under the skin and gives a nice, steady secretion of the hormone for 3 to 4 months. The cream is applied daily, and some individuals absorb it very well, and some individuals absorb it very difficultly. We have no idea who will be the good absorbers and who will be the bad. We simply have to make frequent lab tests in order to determine how well you absorb. We begin at a lower dose and slowly work our way up if we use the cream. If we use a pellet, the predictability is much easier. A calculation is made based on your weight and upon your level and upon your age. And usually that level is very accurate. If there's other complications or fears, we can always reduce the dose and then come back and add a little bit more later on. So that is how testosterone is given. There are some precautions if we use the topical. We want to make sure that we apply it in an area that can't be exposed to other people, so we don't transfer testosterone to other individuals, particularly children or pets, or even other ladies. I generally recommend that the testosterone cream be applied to the thigh area so that it can be covered with pants or even shorts. If that's not an option for a given day where you're going to spend time wearing shorts, then you can always apply it to the buttock area. After applying, you rinse your hands or wash your hands in order to remove any residue from your hands. Another thing that is commonly experienced with the normalization of testosterone is a much better sleep pattern. In fact, one of the first things that ladies notice when we get their testosterone to an adequate level is that they sleep much more soundly than they have been in the past. Obviously, it helps in the normalization of libido, sexual desire, sexual responsiveness. That is an important thing as well. So testosterone is a hormone of great importance and not something to be feared. Estrogen, when we replace that hormone, when menopause occurs, also must go through the skin, or is ideally done through the skin. If we take estrogen by mouth, swallowing estrogen, it increases the risk of blood clots, no matter what form of estrogen is used. For that reason, we prefer to go through the skin. Again, our options are either a cream or a pellet. The same precautions apply to the application of the cream, and the same calculations are used for the derivation of the dose if a pellet is used. When we place all of these hormones in balance, the body feels better, our efforts at work are better, our sleep is better, so many things are better. So why doesn't everyone use hormones? Well, it comes down to a question of safety in most people's minds. There's a great deal of confusion about safety in hormones. Most physicians or practitioners want to persuade us not to use hormone therapy out of the fear of an occurrence of cancer, heart disease, stroke, or other problems. The difficulty with this is a confusion over the difference between what are termed bioidentical hormones and synthetic hormones. I only use bioidentical hormones. What that means in short is the hormones are identical in every way to the hormones that used to be made by your own body. No variance whatsoever. There's not been any group or part of the hormone that's been removed to make it absorb better. There's not been anything added in order to make it last longer. It is exactly the same hormone your body used to make. Now, studies aside, logic would indicate to us that if it's the exact same hormone, then it's going to react the exact same way that it always has. It's interesting for me to hear discussions where an individual will say that estrogen, testosterone, and progesterone are a normal part of a woman's body all through her life. But then come menopause, when the hormones are no longer there, and the discussion of whether or not to give those exact same hormones is had, suddenly these once safe and necessary hormones are suddenly evil and certain to cause cancer, heart attacks, or stroke. That is certainly not a logical way of approaching it. And so logic should dictate that using the exact same hormones is safe, and it is. But we don't have to rely just on logic. Multiple studies have been done and show that these hormones are absolutely safe, and in many cases actually reduce the incidence of heart attack, stroke, and cancer. So what of the fear? Those fears come about because of a study that was done on two hormones back in 1999. This study was called the Women's Health Initiative Trial. In that study, they studied two hormones, only two hormones. They studied the most commonly used hormones in menopausal women of that era. They studied Premarin and Provera. Both of these are not anywhere similar to the hormones that is normally found in a human. The estrogen studied, Premarin, is a horse estrogen, very different than human estrogen. The other hormone is not even a progesterone, it is a progestin. Now, progestins and progesterone do sound similar, but they're very different. A progestin does not occur naturally in any living organism. It is purely a man-made chemical that happens to have hormonal-like effects, similar to progesterone. Progestins can stop bleeding, and it can stop ovulation. Therefore, it's used as a birth control, and it's used as something to prevent bleeding or stop bleeding. But those are the only similarities that exist between human hormones. Everything else in a progestin is exactly the opposite of what occurs when progesterone is used in the body. For example, progesterone protects the heart, the brain, the bones, and many other portions of the body from all of the instant diseases that we've already talked about. Progestins, in this case Provera, actually causes Alzheimer's, causes heart attacks, causes strokes, causes breast cancer, and reduces the calcium on the bones and causes osteoporosis. All the exact opposite effects of normal progesterone. So why would anyone use these types of hormones? Well, that's a great question, and that's a question you'd have to ask another practitioner. I never prescribe any of those hormones. The only hormones I use are bioidentical, which means they do not increase the risk of these types of illnesses. Now, I cannot promise that you'll never have cancer, heart attack, or stroke, but if you do, it's not as a result of the hormones. The hormones are absolutely safe when used appropriately and in the correct dosages.